Hi, I'm Dr. Bomer. Thank you for joining me today with my anti-aging series. Today I'm going to talk about how we age in our face. And the main components for aging are the deterioration of our skin, the loss of bone in our whole face and skull, and the loss of subcutaneous fat, which leads to sagging and shadowing. So I'm going to talk about the way the skin ages now. We have both intrinsic and extrinsic aging. Intrinsic are the factors that we're born with, that are programmed in our DNA, and also the decline of growth hormone, which we are all exposed to as we age. Extrinsic aging are those factors that we are exposing ourselves to. So the sun is a big factor. An interesting example is one on our website in the About Dr. Bomer section that shows a picture of me compared to my brother, who's always been avid with the sun sports, and he never used any sunscreen, and it's interesting to see the difference. And you can see that he has bad sun exposure problems, and my skin looks good because I've been taking care of it. We also are exposed to smoking. You know, some people smoke, and this is very toxic to our entire body, and it significantly affects our skin in a negative way, as well as our diet. Our diet is a very important component in affecting the inflammation in our body, which it affects the inflammation in the skin and can adversely affect our skin with respect to spotting and acne, which can lead to scarring, and so that's a strong component as well. So what's happening to our skin as we age, it's actually getting thinner, and it's losing its water content, and it's losing its elasticity. So what's happening is, youthful skin is, say, this thick. When we get older, it becomes much thinner, and we're losing collagen in the dermis, and we're losing the elastin. So the collagen is really the bulk, and the elastin is what allows the skin to jump back to where it was. And that water content also really helps to maintain the thickness of the skin. And that's the hyaluronic acid in the skin that we lose as we age. We also get melanin deposition or coalescence, where we get the brown spots. So our skin, the color of our skin, whether we're white or African American or Asian, those colors of our skin are determined by the melanin in our skin. And as we are exposed to sun, the melanin gets disrupted and starts to coalesce into spots, and we get the production of irregular coloration. We also get dysregulation of the vasculature, and that can be in response to inflammatory components, and we start to get some reddish discoloration as well. So as you can see in the diagram, this is a representation of older skin and younger skin. You can see the younger skin is thicker compared to the older skin. The older skin has less collagen and elastin, less water content, and also some wrinkling, which is due to the loss of elastin, the lack of spring back to where the skin had been before. So how do we prevent and reverse the aging of our skin? Well, first, we need to really protect ourselves from the sun. Hopefully we're starting when we're younger. I unfortunately didn't have that. I got a lot of sun exposure, a lot of children have. Hopefully these day and age we know about sun, but it really takes that person committing to good behavior and using sunscreen. Anti-inflammatory diet is also very important. If we eat high sugar and a fatty diet, we will have more acne. Dairy is a big component, and acne leads to scarring and pigmentation. And in terms of treating the aged skin, the medical grade skincare products have been scientifically proven to generate the collagen, regenerate the elastin, and rebuild the hyaluronic acid in our skin. They help to speed the skin cycle up, exfoliate our skin, keep the clean pores, and there's no question that they are very effective at doing these things. The over-the-counter products, unfortunately, they are not able to have the concentration of ingredients to have that transformation in the skin. You will get good hydration from the over-the-counter products and maybe a little bit of exfoliation, but nowhere near the rejuvenating properties of the medical grade skincare. And so in addition to the products, the home care that we're doing morning and night, we are doing treatments. So treatments are critical to the anti-aging of our skin, And these include chemical peels, laser treatments, as well as microneedling, and all of these treatments help to build the collagen, the elastin. They do a controlled injury of the skin. It's important that the injury not be too great. If you get too far, then you end up with scarred, funny-looking skin. You want to keep the skin looking natural. And so these treatments need to be done in a very controlled environment, and also with the understanding that they need to be repeated frequently and not a desire to get too much out of one treatment. So again, to reverse the aging, we need to engage in medical grade skincare, morning and night, as well as an anti-inflammatory diet, sun avoidance, and treatments. And so why is it that we get all the shadowing? A big component is the loss of subcutaneous fat pads. We have fat pads all through here, all around our eyes, all through their cheeks, and all of these are diminishing as we age because of the decline in growth hormone. And so this really leads to the shadowing and the sagging that we experience as we age. As you can see in this diagram, there are fat pads all around the eye, the side of the face, and the cheeks, and these are all diminishing as we age and changing in position that leads to the shadowing and the sagging that we experience. So the third component of aging that you all might not be aware of is that our bones are shrinking. The entire skull is getting smaller, and we have bony loss in the orbital rim. All of this gets bigger. The opening to the nose, which is called the piriform here, gets bigger, which adds to the deepening into the nasolabial fold. The cheekbone, the bone recedes backwards, so we get drop of the cheek. And the teeth, actually, this bone where the teeth are connected, all of this diminishes as well, which is why it's really great to consider getting braces as you get older, because that pressure on the teeth actually minimizes the bone loss. And then the mandible gets, which is this bottom bone here, our jawbone, gets smaller, both in length on the side as well as thickness from front to back. And all of these contribute then to the sagging of the tissues that hang down. And as you can see in the diagram, this demonstrates a younger face versus an older face, and you can see how the eye socket is bigger, and the nose hole is bigger, and the cheekbones have diminished and changed angles, and the jaw has become much smaller, shorter, and less wide. And so again, all of this adds to the sagging that we experience as we age. So 20 years ago, when I was in training, the dogma of aging, the understanding of aging was that the face starts to sag because of how many years we've been exposed to the effects of gravity. It's now understood that the reason that things fall down is because we're losing the structure underneath. We're losing the bone and the fat, and the skin is thinning, and everything's falling down. And so historically, the focus was on just lifting, because again, it was gravity, so we lifted up with surgery. But now, because we understand that the bone is shrinking and the fat pads are shrinking, and in a particular way, it makes a lot more sense to restore that volume. And so I've been working on this technique for 10 years. I recognized that volume loss was really a big component, particularly under the eyes and the cheeks was where I was initially learning my new techniques. And I have evolved those techniques to restore volume in pretty much the entire face. And it's a fascinating, wonderful thing to do. Obviously, many of you have seen examples of volumizing in the face where it does not look natural. This is not the way that it needs to happen. It's just required that the techniques are appropriate to what is occurring with aging, and each person needs a little bit of different application depending on their bony structures and what's happening at their certain age. So volumizing is really the key, as well as improving the texture and thickness of the skin with medical grade skincare and skin treatments to keep the skin envelope tight and then restore the volume underneath. And with all of these attributes, we can really effectively combat the aging process.